with our health and what we're eating.
You have to be careful, but I tell my patients, especially when they're worried, I say, you know what though, there's a couple times a year when you just have to give in, and that's Christmas and Thanksgiving.
Mm-hmm.
And you need to watch what you eat, but those are family times to me, and those are the 2 days of the year where I say, don't stress so much about what you're eating that day.
Right.
But in general, yes, you need to watch all of that. But those are special days of the year.
Right. And I have to commend you. You have a wonderful article in Las Vegas Black Image for the month of November, and we're talking about fibroid tumors, and that is something, especially for African American females, we deal with a lot, and we're not even sure if that's what's going on, but you talk about in the article some indicators that let you know when you have a fibroid tumor that's usually non-cancerous most of the time.
Correct.
So tell us about how we know that we might have something going on.
A lot of times when some women have fibroid tumors and have no clue, because they just have no symptoms at all. But for many women, they'll notice a change in their menstrual cycle, so their periods are heavier, or they have more cramping. They have feeling bloated, just feeling full all the time. And it's usually something that needs to come in. You come in and you're checked out, and fibroids are very easy to diagnose. And as you said, they're very common in African American women. So if you come in, it's something that we can easily find. Usually, a lot of times we pick it up just on your annual exam, because as I said, some women have no clue.
Right.
But they realize, something's just not quite right with my body. All of a sudden, my periods are just changing, and I'm not sure what it is, but something's not the same.
Right. And that's crucial. When you say your monthly exams, we have to do that. We have to check on ourselves. Again, now we have the All Women's Health Clinic, and we can go there and check ourselves out with Dr. Annette Mays. And so go ahead and do it, even if you take a buddy with you, because I was thinking, we could do a caravan for a mammogram, because, so many of us are not, checking ourselves out, because we are very, very busy in our days with our business. Again, we want to hear from you. Give us a call, 647-3688. That's 647-3688. We're talking about the business of you, especially our sister girlfriends. How are we feeling? Are we feeling healthy enough to have a business? Sometimes we say, I want to have my own business, but are you healthy enough to have this business? And you have to get your check out. When you say I'm going to run a marathon, Dr. Mays, they come to you and they get a physical, correct?
Yes. Okay.
So if we're going to start a business, then we're going to have to come to you and say, Dr. Mays, because mentally too, if something's going on with you physically, that time of a month, don't mess with me around certain, and my husband knows it best, but certain times of the month, he knows not to deal with me because of a hormone change. We have Tracy on the line. Tracy has some questions. Tracy, what's going on? What's your business? Go right ahead. Hello? Hello, Tracy.
End of your comments, because I'm going to work.
Okay, Tracy.
Does the company give out mammograms?
We do mammogram referral, and we are able to offer you a discount on your mammogram. Last month was Breast Cancer Awareness Month, and the mammograms were offered at a discount. It has been extended through the month of November, so we don't do them physically in our facility, but we set up the mammogram appointment for you, and we're able to get you the discount.
Okay, so can I get that information?
So my office is at 700 Shadow Lane, Suite 165, and if you make an appointment and come in there, we can get you set up for the mammogram.
Thank you.
All right. And we can do this together, because we have to stay healthy. And if we're not healthy, we have no wealth. Okay? It goes hand in hand. Again, we're talking about the Las Vegas All-Woman Healthcare Facility. It's brand new, right on Shadow Lane. The phone number is 522-9640. That's 522-9640. And also you can get in touch with Dr. Annette Mays. She has gotten internet bound with us. She is on Facebook, YouTube, Twitter, and just all the things. And if you have a question, you can definitely go on the Facebook page and post your question. And Dr. Mays, you look at your Facebook and you will answer a question. But you like them to come in the office as well, right?
I do. Yeah. And I will say, the whole Facebook, Twitter, technology is new to me. But I'm doing my best.
Yes, but we're doing, I think, Dr. Mays, you have so many calls. Let me get to them. Tracy, thank you so much for calling in.
You're welcome.
All right. Okay, we have another caller. I don't see her name, but who? Tanya Wah. I love it. Tanya Wah. What's your business? Go right ahead.
Hi, Dr. Mays. You know, I used to work with you. But I want to know, because I'm experiencing fibroid. I was diagnosed with fibroid some years ago. And you had mentioned something about fibroid tumors. So I wanted to know how soon can it be removed without any operations or anything? Because I don't have any insurance right.
They can be removed with what we call minimally invasive procedures. So it is a surgery, but it's not necessarily a surgery where you have to be opened up. It's something that can be done through the laparoscope. There's also medication that we use to help shrink fibroids if you're having symptoms from them. So, yeah, you don't have to just have a hysterectomy. There are other options that can be explored that would be more conservative.
All right. I don't want to get cut on that, really, but I could do it.
Yeah. Well, you got to get in, Tanya. You got to go into the office and get your exam. And that's what we're urging, especially our sisters, to do, because we get so busy and we don't think about ourselves. So please think about yourself. And thank you, Tanya, for calling in. We have Sherry on the line. Sherry, go right ahead. What's your business with Dr. Annette Mays? Hello, Sherry?
Previously, a patient of yours at your last place.
Okay, Sherry, can you say it over, because we're just starting to hear you.
Okay.
I'm sorry.
I would say, hi, Dr. Mays. I'm a previous patient of yours from your last place.
Good morning.
Good morning. You helped me with my daughter, my daughter, and I've been trying to get back to you for years. And I was wondering if you opened up your practice with more insurances due to the fact that you're at a different location now.
Yeah, we have. I mean, we take most insurances we do take, and if you don't have insurance, we also offer payment plans. But yes, we have, because we are in a new location, and we realize that there are patients in that new area that might have a different insurance.
Are you currently taking new clients for prenatal?
Yes.
Okay, awesome.
And you get free, you know what?
Just so I can get back to you.
Thank you so much.
And Sherry, you know what? Tell your friends, it's free pregnancy tests.
I'm already sure.
It's off the chain. Yeah, you can go in and find out if you have a little bundle. So thank you, Sherry, for calling in. Now we have Monica on the line. Monica, you know it's all about you, your business, but your health first. Go right ahead with Dr. Annette Mays.
Hi, how are you guys doing this morning?
Great. What's happening?
My question is about fatigue. What is, like, the common causes of it? What are some remedies, like just natural remedies, how to get rid of it? It's because it's like the serious sore in my life. I got so many kids and Thanksgiving and holidays and running around to do, and it's like the fatigue is just keeping me down constantly.
Well, you know, sometimes fatigue can be just from what you said. Lots of kids running around, you're busy. You do need to be checked to make sure that you're not anemic, because that can definitely cause fatigue. If you're so busy taking care of everybody else and you're not taking care of yourself and you're not eating healthy, you know, sometimes our blood count can dwindle down, and it's just something as simple as taking iron that will help that. The other thing, believe it or not, which I always hate to believe, exercise actually helps fatigue. If you